On one of Oprah Winfrey's shows, she was curious about the state of her heart and underwent a heart scan. This introduced her viewers to the latest technology in heart diagnosis. Here to discuss the benefits of heart scans is Dr. Greg Thomas of Mission Hospital in Mission Viejo.
There's a new type of test now that we're quite excited about as cardiologists. It was developed actually 30 years ago. We could take an x-ray of the heart and we could see calcium on those x-rays in people who had severe heart trouble. With the advent of CT scanning or computed tomography scanning, the type of CT scanning we might get of the brain or the tummy or something like that, we can now do it of the heart. And with a very small amount of radiation, we can look for tiny bits of calcium, just like we used to see with x-rays, but we can see now just tiny amounts with the new technology to evaluate it. And if we have tiny amounts of calcium in our arteries, we actually have blockages in them. They may be just a 10% blockage, but we have blockages. And so we're now testing a lot of people in their midlife to see if they have these blockages or not. And these blockages that are calcified allow us to determine whether or not we should give them medications that can lower cholesterol. And if they do have calcium, so we'll drop the cholesterol dramatically with these medications. Also very exciting on the CT front, that computed tomography front, where we're looking at the heart, is the ability to look at actually arteries with the CT scan. Over the last several years, first in Europe and in the last year or so in the United States, we've been able to do CT scans of the beating heart. So in 10 seconds, we can actually see the arteries that provide blood flow to the heart, and we can see blockages in them. Before the CT scans were this good, it was very blurry because our heart moves, it beats rapidly and it twists and turns with each beat. But now we're able to actually stop the heart action so we can see the arteries. So this type of test is what we call a non-invasive angiogram, or a CT angiogram, angio meaning blood and gram meaning picture. So we can see a picture of the heart arteries actually in 10 seconds, just holding your breath for 10 seconds and then taking the picture without actually even taking one's shirt or blouse off. We can get a good idea how the arteries are. And that test will be evaluated more with research studies. We're also doing some here locally where we're evaluating how good this technique is and how it compares to other type of stress tests. There's a book that I think is terrific that's just out that I'd recommend for anybody who's trying to prevent heart disease. It's called The Forever Young Diet and Lifestyle. It's authored by Dr. James O'Keefe from Kansas City, a professor there, and his wife, Joan O'Keefe. Dr. O'Keefe is a preventive cardiologist who spent his life trying to prevent heart disease, and his wife's a dietitian. And they have a wonderful book that describes the type of diet and lifestyle that I think we should be eating in terms of the type of foods that we're designed genetically for, with a lot of recipes and a lot of things that encourage us to get out there and exercise as well. Another key thing we do to prevent heart disease is not to smoke. With our active, healthy lifestyle we tend to have in Southern California, smoking is pretty unusual. But for those who do, when we do smoke, we actually constrict our arteries and decrease our blood flow just with each cigarette, for example. And doing so increases the stress inside the arteries and tends to promote blockage of those arteries. So if one is smoking, one can actually stop the chance of having a heart attack by 50% the day following the quitting smoking. It works that quickly, it's 50%. Also, it's going to help in a lot of ways. It's going to keep our blood pressure down in addition to keeping our skin looking young, for example, as a side effect like that.